Hi, what's up, guys? Welcome to another episode on the show Behind the Scenes in Health with Dr. Ron. If you're new to this channel, I talk about everything healthcare, health tech. I do interviews sometimes, a lot of fun things and interesting stuff that really, makes a lot of sense and delivers a lot of value. And if that's what you're looking for, you're in the right space. And for those who my returning viewers, listeners, subscribers, thank you all for sticking around. Because of you, yeah, we're going places and moving to the permanent site. So on today's episode, I'll be talking about how to get into health tech. I'm just trying to make it very quick, very understandable, so that to clear the confusion. The other day I was on Twitter. A lot of persons were asking questions. How do we even get into the health tech? Particularly, colleagues, medical doctors, and a couple of nurses, and all of that. So I thought I should just do this video to, make it easy for you guys to understand how to get into health tech. So I'll start by, a quick definition of what is health tech, because I think understanding what it is really helps you, tailor your approach properly into what area you're going into, rather, because health tech is very broad and wide, really. So basically, health technology refers to the use of technology and innovation to improve and optimize healthcare delivery. And ultimately, the idea is to improve access to care, improve patient outcomes, and also reduce healthcare costs for end users. And this involves the use of things like you hear electronic medical records, you hear EPRs, electronic patient records, talk about wearable devices, you talk about AI application, you talk about mobile health application, we talk about telemedicine. All of these are some of the things that constitute health tech, really, but that's another conversation for another day. So a lot of people ask why get into healthcare. Now we are struggling with physician burnout, nurses burnout, everybody's tired, workload, and all of that. I'm not saying you should leave the clinics entirely, but being in the health tech space also gives you a couple of benefits or perks, if you might call it that. And one of them, it gives you the room for growth and innovation. There is really a lot to do in the health tech space, and being in that space, you're able to move from sphere to sphere, area to area. It's really exciting and impactful, and you're also making a difference on a large scale, really. Again, I'm not saying those in the hospitals are not making a difference, but you get what I mean. So you're making a difference on a large scale. It's in high demand, I mean, that's the future of medicine now, the way the trends are moving and going. So it's also good to key into the current trend. Yeah, it's in demand. It offers you flexibility. Some of us work from home, some people work remotely. I know a couple of data scientists who, they work remotely. You don't see them in the office. They just, once they have good internet and laptop, they are all home and try to deliver on their job deliverables. Then you're also able to partake in exciting and challenging work. Yeah, clinical work is challenging, is exciting, but also on the health tech side of things, it's really also exciting. So, but it gives you a different type of excitement, if I may use that word, if you're in the health tech space. So these are some of the perks of being in the health tech space. And again, I forgot to mention the salary. Some of the roles really pay very well, for the amount of effort you put in. So you might just want to check it out. I think we made a video about different health tech salaries. You might want to look for that and check it out. I did that video with Dr. Godwin. So we looked at about 25 different roles in the health tech space and how much they earn in the UK, in the US, and Canada, I think, right? So just look for that video, right? So these are some of the perks of being in the health tech space. Now, quickly, I'll just like to classify health tech jobs. So I usually like saying there's a broad umbrella called health tech. Then you put coding and you put the non-coding job. So a lot of people always, think that health tech is coding, coding, coding. When we say coding, we mean people who actually sit down, write the codes, how the computers or applications work and all of that. That's like the hard coding. But on the other side, the non-coding roles mean you don't need to write those lines of code. It's not your business, it's not your headache, right? So those are the non-coding jobs, and those are the areas you might find interesting if you really don't have time to say, I want to sit down and learn how to code and all of that. So that's the two broad definitions of health tech jobs: the coding and the non-coding roles. So, for example, software developers, data scientists, engineers, those ones they do coding and all of that. But when you move to the non-coding parts, talk about the project managers, talk about product managers, talk about the business analysts, talk about the UX guys, they really don't do a lot of coding per se. So you might find those areas interesting, right? So I'll just pull up my screen to show you some of the different roles that sit between coding and non-coding roles. So for the coding jobs, you can see the health data analyst, the healthcare data scientist, you see the mobile app developer, you see the software engineer, the database engineer, you talk about the EHR developer, front end engineer, full stack dev guys. While on the non-coding jobs, you have the project manager, you have the product manager, you have the business analyst, you have the marketing guys, you talk about UX designer, you talk about quality assurance, talk about sales manager, you talk about technical writing, talk about training specialists, talk about communication specialists. There are also people who you call learning and adoption specialists, and all these roles you don't need to know how to code to do all of these jobs, right? So getting into tech, usually I would say you need to do a quick self SWOT analysis. You need to understand your why of getting into tech. Are you getting into tech because everybody is jumping into tech? I usually say tech will not be for everybody, just the same way clinical medicine or clinical care is not going to be for everybody. So you need to understand your why of getting into health tech, and you need to be very honest about your reasons why you want to get into health tech and all of that, right? So for the SWOT, S is for strength. So what are your strengths really? What certifications do you have? What experiences do you have? What projects have you completed successfully? This is very important. Now, what are your weaknesses? Which skills are you lacking? Which certifications are you lacking? What bad habits do you have? For example, are you poor at communicating? Uh, do you suck at teamwork? These are some weaknesses. What are the opportunities? Where do you see areas for change or improvement in whatever deficiencies you might have? The current position you're looking for, do you really match the skill sets they are looking for? Then the threats too is are your peers doing better than you in a particular job or role? Are your personal traits hurting your character advancement? So for some people, I mean, you keep checking, why am I not being promoted and all of that. So there could be some threats that are really, pulling you back. So this SWOT analysis is really, really key to understand the why. And you can also ask for honest feedback from your family and friends. Yeah, they won't lie to you, to really tell you who you think you are. So after doing the SWOT analysis, the next thing for you to do is to look at what transferable skills you have. So I think this is a big advantage for medical doctors, nurses, or those who are generating in the healthcare space, because they have a lot of transferable skills that we've been using in the healthcare space that can easily transition into the tech space or health tech space, really. So, and most times these experiences is something, or these skills rather, is something we obtain them in the hospital through our day-to-day interaction with colleagues, with patients, and maybe vendors or senior management, depending on your role, right? It's also part of the things you gain through your education and all of that. And basically the different jobs you've done over the years in your career. So all that gives you a lot of skills, transferable skills you can move into the health tech space. So in the health tech space, I think the focus is usually on the soft skills and hard skills. But I think from my experience, it's more of the soft skills, things like communication, things like problem solving, things like critical thinking, things like teamwork, things like time management, things like creativity, things like being able to pay attention to the tiniest details. So these are some soft skills you 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 find useful in the health tech space. So if you don't have them, I think this is the time to start developing those soft skills, right? So yeah, you've done your SWOT analysis, you figured out the transferable skills you have, right? So again, you're now thinking about in some cases you might need to get some extra certifications or trainings or whatever. So it now depends on you. So you might want to look at possible degrees and certifications or hands-on experience. So in terms of degrees, you might want to be looking at things like, am I going to do MSc Health Informatics or Digital Health or Health Data Science or Artificial Intelligence, postgraduate degree? Or are you going to do certifications rather, maybe like health IT support, AI in healthcare, business analytics, and you know, there are a lot of short courses like that and on Coursera, EDX, and all of that too. I just want to check them out. Or do you really want the hands-on experience? There are a couple of boot camps that currently go on. You just want to check out for them, or internships or personal projects. So these are ways you build hands-on experience. And from my own experience too, I think the hands-on experience really, really comes in handy because a lot of the roles I interviewed for, they they want to know what you've done so far. So it's not really much about, okay, what qualification, what have you really done? So in hindsight, most of the things I've done on a personal level, I think they really come in handy. So you might want to look at your hands-on experience. And how do you get some of this thing? A good way is to volunteer for some companies. Really, I did a couple of projects that I wasn't paid for, but down the road, those activities or projects I worked on, they really came in handy because I have them all on my CV. So you might want to volunteer for some companies. You're able to offer advice or consulting and all of that. So that's a good way to gain hands-on experience. So once you feel you're comfortable enough, then you start looking for the jobs, right? The jobs are everywhere. So you need to have a search strategy. There are specialized job boards for some health tech roles. You want to find out which of the companies are recruiting. And you want to use LinkedIn to your advantage, really, because a lot of recruiters are out there. Most of the companies are out there. Optimize your LinkedIn profile, reach out to recruiters, reach out to companies, pitch yourself, sell yourself, and so basically, and set up notifications to get notified when such openings are possible. So basically, you need a strategy for finding those jobs. So if you're looking at working in the UK, for example, you might want to look at sites like jobs.nhs.uk or nhsjobs.com or NHS Digital. There are a few. Then, I mean, there are other platforms like Wellfound, which usually we call Angel List. You have a remote.co, you have a remote for me or just remote. So all of these platforms usually host a lot of health tech jobs. So it's for you to sit down and dig for that stuff, right? So, yes, I also forgot to mention that you need to network, look for people who have been in this space, ask them questions, send them messages. This what's going on. How do you think you can help me, or how can I go about it, and all of that. And the truth is, most often than not, they are really willing to, spend. Yeah, we understand people's time are very precious. Every minute is money, but some of them are able to squeeze out some time and put you on the right path on how to go about it. I mean, it makes a lot of sense when you learn from people who have gone that way, so that you don't make the same mistakes they've made down the road. So you look for the jobs, and you apply for the jobs, and yeah, you go for your interview, and yeah, you land your dream job, basically. So I think, I mean, the job application process is another conversation on its own. Maybe I'll just make some time to do a video on that, but it's another process itself, and it's painstaking. I tell people looking for a job is a job, really, especially in the health tech space. Because the truth is, these jobs don't just fall out of the sky, and yeah, you have to find them. So get the job, attend your interviews. I probably should do a brief session on how to attend interviews, what kind of questions to expect, and all of that. And yeah, then you land your job and you get into get the ball rolling, really. And also another thing a lot of people might fight is the imposter syndrome, and yeah, I also went through it, but you get a hang of it, because the truth is, all of us, we are sure just trying to find our way around the whole thing. Nobody knows it all, but I mean, the skills you have or whatever knowledge you have, if you're sure of those ones, I think you should be confident enough to work with those while you figure out the ones you don't know. I mean, that's how everybody really gets by. Nobody has all the information, really. So I think that, in a nutshell, I hope I've been able to break down how to get into health tech for you. And yeah, if you've liked this video, if you love this video, please subscribe, share with your family and friends. And yeah, I'll see you in the next episode. Bye for now.